What if the tiny white pill you reach for when your head aches could quietly harm your heart or even your liver months or years later? You'd expect an over-the-counter drug to be safe when used as the label says. But new warnings and decades of studies show that some of the most common painkillers on store shelves carry real, and sometimes hidden, risks. Today we'll name 5 familiar OTC pills linked to liver or heart damage, explain the science, and tell you how to protect yourself without panicking. Stay with me, because knowing one small fact could keep you out of the emergency room. You're watching BizWorld Explorer. We dig into everyday products and show what's behind the labels. If you want clear, fact-based breakdowns you can trust, hit subscribe and turn on notifications. Now, let's get into it. Quick safety headliners: acetaminophen, Tylenol, is the single most common cause of acute liver failure from drugs when taken too much. This is documented by major clinical sources, and the FDA, non-aspirin NSAIDs, Ibuprofen, Naproxen, Diclofenac, can raise the risk of heart attack and stroke, sometimes within the first weeks of use, especially at high doses or long-term. The FDA strengthened warnings about this risk and requires clearer labels. Number 1. Tylenol and generics, liver damage. What people use it for: fever and mild to moderate pain. It's everywhere: pills, cold medicines, prescription combos. Why it can be dangerous. Acetaminophen is safe at recommended doses, but the margin between a safe dose and a harmful dose is smaller than many people realize. Overdose, accidental or intentional, can cause severe, sometimes fatal, liver injury. The liver metabolizes acetaminophen to byproducts. In large amounts, those byproducts overwhelm the liver's defenses and damage liver cells. Even repeated slightly high use can be risky for some people. Regulatory note: the FDA says, don't take more than the label allows. Always check for acetaminophen in combination products, and ask a doctor before use if you have liver disease. The agency also limited the amount of acetaminophen in many prescription combination products to reduce accidental overdose risk. Typical scenarios where harm happens: mixing several products, cold plus pain plus sleep aids, that all contain acetaminophen. Taking extra just-in-case doses when pain persists. Drinking large amounts of alcohol while taking acetaminophen. Alcohol raises the chance of liver damage. What to do instead/safety tips. Read labels. If a medicine lists acetaminophen, note the milligrams per dose and the maximum per 24 hours. Do not exceed 4,000 milligrams per day, and many experts recommend staying below 3,000 milligrams per day for long stretches. Ask a doctor. If you drink heavily or have liver disease, take much less or avoid it. Keep an exact log if you use multiple over-the-counter or prescription meds. If you feel nauseous, jaundiced, yellow skin, eyes, or very tired after taking acetaminophen, get medical help immediately. Number 2. Ibuprofen, Advil, Motrin. Heart and stomach risks with long or high-dose use. What people use it for: pain, inflammation, fever, often used for headaches, injuries, and arthritis. Why it can be dangerous. NSAIDs like ibuprofen may raise the risk of heart attack or stroke. This risk can occur early, within weeks, and the risk tends to increase with higher doses and long-term use. NSAIDs can also cause stomach bleeding, especially if combined with alcohol or blood thinners. Regulatory note: the FDA strengthened labels on NSAIDs to warn about increased heart attack and stroke risk, and instructs people to use the lowest effective dose for the shortest possible time. Typical scenarios where harm happens: regular daily use for months, often by people self-treating chronic pain. taking high over-the-counter doses for back pain or headaches every day. People with heart disease, high blood pressure, diabetes, or high cholesterol are at higher risk. What to do instead? Safety tips. Use the lowest effective dose for the shortest time. Don't take daily for weeks unless a doctor recommends it. If you have heart disease, recent heart attack, or stroke, ask your doctor before taking ibuprofen. Consider alternating pain strategies, topical non-steroidal anti-inflammatory drugs, cream, chalk gels for localized pain, acetaminophen if liver safe for you, physical therapy, or doctor-supervised alternatives. Report side effects like chest pain, shortness of breath, weakness on one side, or black stools immediately. Number 3. Naproxen, Aleve. Longer relief, hidden risks. Naproxen, commonly known by the brand name Aleve, is one of the most widely used over-the-counter pain relievers. People often choose it for longer-lasting relief from body aches, menstrual cramps, headaches, and arthritis pain. Unlike some other painkillers that need to be taken every few hours, naproxen's effects can last up to 12 hours, making it a convenient choice for many. However, what many don't realize is that naproxen isn't as safe as it might seem. It belongs to the same drug family as ibuprofen, the NSAIDs, non-steroidal anti-inflammatory drugs. These drugs work well for pain and inflammation, but can increase the risk of heart attack or stroke, even in people without prior heart problems. The FDA strengthened its warning in 2015, confirming that all non-aspirin NSAIDs, including naproxen, carry this risk, especially at higher doses or with long-term use. Problems often occur when people take naproxen daily without consulting a doctor, or when they combine it with other NSAIDs or blood thinners. Safety tips. Use the lowest effective dose for the shortest duration possible. If you need long-term relief, consult your doctor about safer chronic pain options, like disease-specific medications, physical therapy, or topical treatments that have fewer systemic risks. If this is helpful so far, do us a favor. Hit like and subscribe. We post clear explainers like this often, and clicking that bell helps you catch our next video on safer pain relief strategies. Now back to the facts. Number 4. Diclofenac, higher cardiovascular risk signals. What people use it for? Pain from joint or muscle issues. Topical diclofenac is now common OTC in some countries and prescription elsewhere. Why it can be dangerous. Among NSAIDs, diclofenac is associated with a higher relative risk of cardiovascular events in several studies. The same FDA concerns about heart risk apply. Some researchers point to diclofenac as one of the drugs with stronger signals for heart problems. Typical scenarios where harm happens. Long-term use for chronic joint pain. Use in people with pre-existing heart disease or risk factors. What to do instead? Safety tips. If you need chronic pain management, ask your doctor if topical diclofenac is appropriate. Topical forms limit systemic exposure, but are not risk-free. Check with a physician if you have cardiovascular risks. Number 5. Aspirin, bleeding risk and careful use. Aspirin has been around for more than a century and is often seen as a safe and familiar pain reliever. People use it for headaches, muscle pain, fever, and inflammation. Many also take low-dose aspirin daily for heart protection under their doctor's supervision, a practice that has helped millions of people with existing heart disease. However, despite its reputation, aspirin isn't harmless. When used regularly as an over-the-counter painkiller, it can significantly increase the risk of gastrointestinal bleeding, stomach ulcers, and even internal bleeding. The risk becomes higher in older adults or when combined with alcohol, steroids, or other blood-thinning medications. In recent years, medical guidance has shifted. The FDA and major health organizations now recommend against self-starting daily aspirin for heart protection, unless prescribed by a doctor. For many people who have never had a heart attack or stroke, the potential bleeding risks may outweigh the benefits of prevention. Aspirin's safety depends heavily on your medical history, dosage, and other medications you might be taking. Typical scenarios where harm happens. Taking aspirin daily for general aches or headaches without realizing there's an ulcer. Mixing aspirin with other blood thinners or frequent alcohol use. Safety tips. Only take daily low-dose aspirin if your doctor recommends it after evaluating your heart and bleeding risks. For regular pain, consider safer alternatives or short-term use only. Watch for warning signs like black stools or vomiting blood, which require immediate medical attention. So, how big is the risk, really? 2 short points to keep perspective. Acute overdose of acetaminophen is a real and common cause of liver failure, and it's largely preventable by following label doses and avoiding multiple acetaminophen-containing products. The heart risk for NSAIDs exists, but depends on dose, duration, and patient factors. Short courses at recommended OTC doses for most healthy people may be low risk, but daily or high-dose use, or use by people with existing heart disease, is where danger rises and regulators warn caution. Practical rules you can follow right now. Read labels carefully. Know what active ingredient you're taking and how many milligrams per pill. Many cold and flu combos hide acetaminophen. Set a daily cap. Don't go over the recommended limit, and if you take acetaminophen regularly, check with a doctor about safe long-term doses. Use non-steroidal anti-inflammatory drugs short-term when possible. If you use them daily for longer than 2 weeks, talk to a doctor. Avoid mixing drugs without checking. 2 over-the-counter drugs together can be dangerous, e.g. yours, acetaminophen plus a combo cold pill. Tell your doctor about alcohol use. Alcohol and acetaminophen together raise liver risk. When to call for help. Warning signs. Certain painkillers can cause serious harm if misused, so recognizing danger signs early is crucial. Acetaminophen overdose. Watch for nausea, vomiting, stomach pain, yellowing of skin or eyes, jaundice, or confusion. These can signal liver damage. Get emergency medical help immediately. NSAID cardiac risk. If you experience chest pain, shortness of breath, sudden weakness on one side, or slurred speech, call emergency services right away. These may indicate a heart attack or stroke. Bleeding warning signs. Black, tarry stools, vomit that looks like coffee grounds, fainting, or severe stomach pain can point to internal bleeding. Stop the medication and seek urgent medical care. Early action can save your life. Final thought. Practical, not panicked. Over-the-counter doesn't mean risk-free. These painkillers can be incredibly helpful when used properly, easing headaches, fevers, or chronic aches. But the same medicines can cause serious harm if overused or combined carelessly. The good news is, most risks are preventable. Always read the label, avoid mixing multiple pain medicines, and stick to the lowest effective dose for the shortest possible time. If you find yourself needing pain relief for weeks or more, it's time to talk to your doctor. Smart, careful use keeps these everyday drugs safe and effective for when you truly need them. Thanks for watching BizWorld Explorer. If you learned something useful, please give this video a like and share it with someone who takes pain medicine regularly. You'll find the official FDA links in the description for more details. And if you found this investigation eye-opening, you'll definitely want to check out our previous video. KFC Exposed. The scary truth about what's really in their chicken. It reveals shocking facts about what's really behind those crispy bites. Comment below with your thoughts or experiences. We actually read everyone. Stay safe, stay informed, and I'll see you in the next deep dive.